Good morning to you who accompany us every day and make this transmission possible, to Abdiel who accompanies us from the studio, and to all those who follow us, who are according to what I have been told, not only in Cuba but also abroad, some people follow the information provided by the Ministry of Public Health. Today we have to convey our condolences to a group of relatives and friends for the death of a 78-year-old Cuban male citizen from Havana, from the municipality of Cotorro. The deceased was one of the homeless persons who found protection in a shelter and who had a history of high blood pressure, diabetes mellitus, a chronic obstructive pulmonary disease, a lung neoplasm, and a severe protein calorie malnutrition. As you see, a group of diseases that conditioned a very unfavorable evolution of this disease. This patient, after a 21-day stay in the hospital, died yesterday in intensive care unit of a hospital here in Havana. An attempt was made to resuscitate him from cardiorespiratory arrest, but it was not really possible despite all the efforts of our professionals and technicians. We reiterate the condolences to relatives and friends. There are 689 patients admitted to our hospitals. This is the lowest figure we have had in the last 21 days. Surveillance is kept on 11. There are 455 suspects, and 223 are confirmed cases. In the primary health care by our specialists, professionals, and graduates, 1,697 people are being followed up. Yesterday, our molecular biology laboratories processed 1,743 samples of suspicious cases, contacts, and some people already confirmed with COVID-19. 741 in the laboratory of the Pedro Curie Institute of Tropical Medicine, in the molecular biology laboratory of the Provincial Center for Hygiene, Epidemiology in Santiago de Cuba, 283, in the laboratory of Havana, 282, in Villa Clara, 248, and in the Brothers Aimejeras Hospital, 189. As a result of the study of these 1,743 samples, 8 were positive. We are talking about the 0.5% of the samples tested positive from those studied yesterday. In this way, Cuba accumulates 89,031 analyzed samples and 1,908 patients diagnosed with the SARS-CoV-2 virus and with the COVID-19 disease. The 8 new cases confirmed yesterday, all of them are Cuban. This is a trend that we have been experiencing for several days now. 7 of them were contacts of confirmed cases, and thus 89.2% of the patients diagnosed in our country are contacts of confirmed cases. That is 1,667. In one of the 8 cases diagnosed yesterday, it has not been possible to specify the source of infection. There are 69 cases with that characteristic in our epidemic, in which the source of infection has not been specified, despite the epidemiological study being carried out. The number of people diagnosed as having a source of infection from abroad remains unchanged at 131, or 7% of the diagnosed cases. We remain, in terms of sexes, on unequal parts: 4 of the male sex, 4 of the female sex, and anyway, in the accumulated total, the female sex remains at 48.8% of the cases diagnosed in our country. 19